Good morning and welcome to another edition of COVID Calls with me, Chris Perugin. Today we've got a very special guest who's going to be taking many questions, both from me and I'm sure from the public as well. Our guest is Health Minister and Deputy Prime Minister Chris Fearne, who's obviously been handling this COVID-19 crisis very significantly in his role as Health Minister. So, Mr. Chris Fearne, can you hear me well?
I can.
Perfect.
Can you hear me?
Yes, I can. Thank you very much for being with us. To the audience, I'm conducting this interview in English.
As long as you keep calling me special, I'll keep coming.
I just want to say that we're going to conduct this interview in English, given that there's a lot of Maltese content out there on TV and press conferences, and we have a lot of expats as well who will be watching today. So I've got a lot of questions, Minister, so I'm going to get right to it, and we'll try and be as brief as possible because we've only got 40 minutes together. So first of all, is Malta managing to flatten the curve? Are the measures that we're taking working, or is it still too soon to tell?
Well, good morning in the first instance to you, Chris, and to whoever's hearing us and watching us on. I believe it's live, no? So we'll be getting reactions.
We're live. We already have a few hundred people.
Okay. Well, right. So early on, when we started getting our own figures, right? So when we started getting our own numbers in, we modeled what the epidemic was going to look like here in Malta. So we used, there are several models that are available. We used one which is right for a small, densely populated island state, right? So we used basically the Hong Kong model, which is more or less something which we can apply to Malta. And based on our model, we're more or less doing according to what we predicted would happen. In fact, we're actually slightly ahead, slightly better than the curve that we were looking for. Let me explain something. What counts is where we are with the capacity to provide care to whoever needs it. Early on, very early on, we set a target for ourselves, which was to be able to provide healthcare to whoever needs it during this pandemic, during this epidemic. That's a very ambitious statement and a very ambitious target. Most countries, including countries in the Western world, in Europe and the States, most hospitals, most cities have not managed to do that, and are still not managing to do that. So you see countries like cities like New York, like Milan, like Paris, like London, where people are actually dying, not just because of the virus, but because the healthcare systems are overwhelmed. We've set ourselves a target.
Overwhelmed yet?
Sorry?
In our case, the healthcare system is coping well.
So we set ourselves a target that even during the worst part of the epidemic, so when we peak, we need to be able to have enough, basically ITU beds and staff to man those ITU beds to be able to care for whoever needs care. So the model that we chose to follow is where at the peak we have just enough capacity to be able to cope with everyone. So now we've increased our capacity to a phenomenal extent. Most countries have struggled to double their ITU capacity. Most countries have struggled to double that. We have, and we are increasing our ITU capacity tenfold, not double, tenfold. So from 20 ITU beds, we're going to 200 ITU beds, which is phenomenal.
But Minister,
so,
in the last few days, we've been registering single-digit positive cases. What is our trend line showing, and when do you expect to reach our peak?
Yes. If you give me a minute, I'll explain. So the target that we need to go to is to have our curve, which at the peak doesn't go beyond what we can provide as far as healthcare capacity goes. As I just said, we've expanded our healthcare capacity to the limit. We don't have any more doctors, any more nurses who will be able to provide care, even if we have more ITU beds than the 200 that we will have at the peak. We're almost already there as far as the beds go. So we need to keep the curve along that line. And that's what we modeled. If we look at the numbers today, so today we have prevalence of about 350 cases. So we're just below 400 confirmed cases of COVID in Malta. Unfortunately, 3 have passed away, 44 have recovered, more will be recovering in the next few days, which brings us to about 350 active cases. If we look at the curve that we would like to follow, in other words, the curve that at the peak will bring us up to, but not beyond, the maximum capacity, 350, we would have reached that about 7 or 8 days ago. So we are actually about a week better along the curve than what we predicted would be the maximum that we can take. So as far as numbers go, we're on the right track. Of course, there is no room for complacency because we're on the right track, because our social measuring measures, our social distancing measures are working. People are more or less.
But when do you expect we will
collaborating? Sorry?
But when do you expect we will reach our peak? So, and what would the number look like?
It's not a question of days. It's a question of weeks, if not months. But it doesn't mean that we will remain with the same social distancing measures that we have today in a month's time or in 6 weeks' time. Things will vary from one day to another according to the evidence that is available. I mean, if you ask me what was the best thing we've done in this epidemic, is that we are following the evidence, that we are going and we are tackling this in a scientific way. And I think this is making a difference because people are collaborating, people are cooperating, people recognize that this is the best way to go, and our communication strategy is working. We've been completely transparent in this, and I think there's a lot of collaboration and cooperation. So yes, we're on the right track, but no room for complacency, certainly.
And no specific targets in terms of what it's going to look like in 2 weeks' time or in a month's time, etc. Right? As in, that's still something that's.
It will all depend. It will all depend on how rigorous people are in following the directives that we have been issuing. At the moment, there is a lot of collaboration. You see a few people here and there, but in most cases, people are collaborating to a very, very large extent. If we continue to follow this path, if we continue to follow this amount of collaboration, cooperation, it will not be a question of months. It will be a question of weeks.
Is there also something to be said about the infectious dose in Malta? Because in other countries, there seem to be more severe cases.
What do you mean?
Even in terms of younger people, seem to have more severe reactions. In Malta, the symptoms seem to be generally mild.
No.
Is there anything to
No, that's a complete myth. There's nothing special about Maltese people that make them more prone or less prone to be infected by COVID than anybody else. It's just we just have to make sure that we isolate the case, that we find people who are positive, so testing, which is extremely important, and we keep increasing our testing capacity, isolate people who we find to be positive, and quarantine the people around them. So that's it. There's no magic. That's what we need to do. That's what we're doing. That's what we need to continue to do.
In hindsight, could Malta have been prepared any better for this?
Could the world have been prepared any better for this, Chris? The answer is yes. The world could have been prepared better for this, of course. Every time somebody dies, we could have done something better to prevent that death. The world could have been prepared better. If you look back 4 or 5 years ago, when there was the Ebola outbreak in Central Africa, and there was a bit of spread around, even in Europe and the States, the global response and the WHO response at the time was abysmal. We've learned from then. So the Ebola episode, the Ebola epidemic, has taught us already and has increased our level of preparedness, even at least psychologically. So this time around, WHO and most countries have been quicker off the mark than they were with the Ebola 4 years ago. But yes, still there is a lot that we need to learn from this. Certainly, and we're doing this. We're meeting on an international scale regularly through video conferencing, as I'm doing with you today. Because yes, there are lots of lessons to learn. Because this will not, unfortunately, be the last epidemic that we will face. And the bigger the population worldwide, the bigger the risk of epidemics occurring.
In fact, my question is this: like, if there is a secondary outbreak in Malta, let's say in a few months' time, we get over the West, and in a few months' time there's a resurgence. Would you have done anything differently? Would you have sourced, I don't know, more protective gear? Would you have? Would there be anything?
No. We started looking at this seriously in January. There were countries who took it lightly and who denied that this was going to be a global problem, but we didn't. We started preparing in January. I mean, we have staff at Malta Day, CPSU, FMS, primary healthcare, Mount Carmel. We started preparing at an early stage. We sourced a lot of protective equipment. We sourced a lot of ventilators, not just ventilators, but monitors. We sourced also ancillary medicines and stuff that we want to need. What we don't have today, and what we are insisting that the European Union is proactive in, is the availability of vaccines once they come onto the market. Of course, there aren't vaccines anywhere, and it's going to take at least 6 months until a vaccine is brought onto the market. But bringing it onto the market and making it available to populations is a different matter. And we know that there's going to be a cutthroat competition to get the vaccines to our citizens respectively as soon as possible. And the bigger countries, of course, because they are always the stronger countries, will have an advantage. So we've been asking the European Commission from very early on, from February, set up a joint procurement mechanism, buy the vaccines yourself, and then distribute equally or fairly between European member states. Till now, the European Commission is still slow on this. They have joint procurements for mechanisms for ventilators, for protective clothing, for different medicines that are used in ITU. But for vaccines, the mechanism hasn't started. And we've been insisting with the European Union, because we are the smallest country and realistically we have the least clout when it comes to basically to the war of buying vaccines. So we need the European Union to act in solidarity and get itself in order and make sure that there is the joint procurement mechanism for vaccines. We keep insisting on this, and we'll keep on insisting, because this is going to be an extremely important development in the months to come.
But there were also difficulties with procuring certain equipment as well, right? As in, this is there was global shortages of certain equipment, and
we're okay. That, as a country, we're fine.
If I can just ask the question, we're hearing that there are even health workers who are complaining that they're being asked to use surgical masks instead of N95 masks. So would you say we've got the best? Would you say we've got the best protective gear available and enough of it? And would you say as well that, how would you respond to, is it normal for a number of health workers? In our case, I believe there's about a dozen health workers who have been infected. Is that a shortcoming from our end, or is that something that's totally unavoidable?
Okay. So let me answer your basically two main questions. Protective equipment, we have enough. We have continued to source. More keeps arriving every day. At least, certainly on a regular basis, and we are providing the adequate and the appropriate protective equipment to the healthcare workers who need it. So anybody who is facing COVID positive patients have the appropriate masks, visors, gowns, gloves, the whole lot. So no, you're wrong when you say that people who are facing COVID patients don't have the appropriate masks. You're wrong. Now, we are also looking after our healthcare workers, even those who are not in direct contact with patients who are COVID positive. Now, we're testing everybody who comes into hospital. So all patients who come into hospital are being swabbed. So we know exactly who is and who isn't COVID positive. Still, we are still protecting, and we're ramping up protection for those nurses who are looking after patients who are not COVID, right? So the COVID positive patients are all being looked after by staff who have the full equipment and the appropriate equipment. Strictly speaking, those nurses and staff, doctors who are not looking after COVID positive patients really and truly don't need that type of equipment. But we are also ramping up equipment there. So over the next few days, we are providing visors for everyone. We've started in casualties, and then we're going to provide for the whole healthcare worker staff. Now, we've also started testing our healthcare workers. If you look at the figures coming out of the UK, the UK figures show that 30%, 30% of their healthcare workforce are COVID positive. Belgium are reporting 50%, half of the workforce. Netherlands, 50%, half of the workforce. In Malta, the studies that we've done, real life studies, real time, show that we have 1% of our workforce which is infected. So 1% is more than zero. So we would like zero.
Yeah.
But it's much less than 30%, much less than the 50% that are being reported in European countries.
Minister, there's obviously a huge amount of focus on COVID-19 in the healthcare sector, but still there are all the other healthcare related problems that are happening, right? We received some concerns from families, especially who have relatives in hospital, who are feeling like the care being given to non-COVID patients is not what it used to be, and there is also, I think, a sense of fear among healthcare workers not to be too close to elderly patients and other things. What's happening over there? How much is COVID affecting other treatments and other types of healthcare?
So you need to break this into two aspects. There are services which we have postponed. So there are services that we have knowingly decided to postpone. So elective surgery, elective appointments, follow-up appointments, screening, IVF, several tests, which we have taken the decision early on. Let's postpone these. This has happened the world over, not just in Malta, by the way. But let's postpone these so that we can concentrate our healthcare workforce and all our resources into providing all the care that we need to provide for COVID patients. But some services have continued. So emergency surgery, urgent investigations, acute admissions to hospital, these have all continued. Now, the services that we have continued to give in the high level of care and with the high standards that we are used to in our healthcare system. So any service that we give to the same level, with the same standards, as we've always done over these last years. So there's no excuse for anyone who is giving a service that we've decided to keep going for not giving their full commitment to that service. And I have to say, I'm extremely proud of our healthcare workers who have been doing a really, really good job, both those who are looking after COVID patients and the rest who are not.
And I think
on the other hand, we have, hang on, because this is only half of it, there's the other half. On the other hand, there are those services that we have decided to postpone. We cannot postpone indefinitely. So we cannot leave patients who need follow-ups for their heart problems, follow-ups for the diabetes, follow-ups for the renal problems, people who are waiting for elective surgery, for a hernia repair, for a hip replacement. We can't leave those waiting indefinitely. So what we started to do over the last few days is that we set up a transition team, which is a team of technical people who are looking at starting to ramp up services now, in parallel to the services we are providing for the COVID and for the emergency situations. This means that we're going to have to increase our resources, not just human resources, which are finite, but also resources when it comes to bed space, when it comes to equipment, because we want to keep the reserve in place for the COVID patients if the situation goes to the extent that we need all the preparations that we have done. So we can't start ramping down on the COVID preparations. On the other hand, as time goes by, we start reintroducing some of the services that we have postponed. And we're doing this in a gradual and in a systematic and studied manner.
How do you reconcile and balance out the sort of health, preventative measures, the measures to protect health, with all the other things that this is causing, right? So primarily the economic bit. Do you think that we are being too cautious on the health side and not cautious enough on the economy? And we'll speak about it later. Even the mental health impact and other impacts that are being triggered by this.
Okay, so let's answer a bit about the health and the economy. And this is an important argument. It's an important question because there's a big myth surrounding this. There's a myth that we are governments or health ministers or cabinets or whoever have to decide between providing adequate healthcare or looking after the economy, as if there's a balance and the health is on one scale and the economy is on the other scale. That's wrong. That's wrong. We know for a fact that good health comes and with a good economy. So if you look historically, if you look at those over the years, if you look at those countries who have the best healthcare systems, by and large, you find that these are the wealthier countries in the world. And if you look at the poorer countries, you find that in poorer countries, populations enjoy a lesser standard of healthcare and a lesser standard of health. So if you look at life expectancy in certain countries in Africa, for instance, it's much lower than it would be in Europe. Or Malta, as it happens, has the highest healthy life expectancy in Europe and probably in the world, which means that we have an extremely good healthcare system. But a good economy brings about a good healthcare system. Right, so that there's no argument about that. As I say, if you look at the poorer countries, the citizens have a lower standard of care and of health and of wellness and of well-being than people who live in more economically stable and richer countries. But the converse also happens. So healthy people and the healthy population brings about a good economy. Because health and wealth go hand in hand. So even with this epidemic, and this isn't the first epidemic the world has seen, so we know what happens. It's not a question of who comes out of this fastest. It's a question who comes out of this healthiest, because those countries or those regions who recover even health-wise the best have a better outcome for their economy in the shorter and in the medium term.
But if I may,
so it's not a question of getting this over with as soon as possible, but it's a question of getting this over as healthy as possible. As I say, health and wealth go hand in hand.
But if I may, there is not just the health concern of being COVID positive. There's also other health concerns. I mean, yesterday the Richmond Foundation published a survey, which is quite shocking. You know, that 50%, almost 50% of people are saying they're depressed most of the time. You know, and there was a large number of young people, especially, who are considering self-harm and suicide. So, are you worried that to protect our health from a COVID perspective, it's going to result in secondary deaths, even by things like suicide, or, as we'll talk about a bit later, even migrant drownings, for example? Like, what are we? There is this fear that, especially on a mental health perspective, the economy's almost complete standstill could result in deaths from a secondary nature. You know, not COVID related.
It's all part and parcel of the same situation. So when you say that we have a response for the pandemic, for the epidemic, it includes also looking after the healthcare, the mental health care of our citizens. We're very conscious of this. We know this. In fact, the reason that we keep bringing in measures at a measured pace rather than to put in lockdown from day one. And we had pressure from various sectors, not least from yourselves and from the opposition party, and to bring in a lockdown practically from day one. What we've done is that we've brought in only those measures that we thought were needed, not more, because we know that people there is a price to pay even for every measure that we bring in, including on our mental health. So yes, there is a measured response to the situation. What we need to do is to make sure that we do not overrun the capacity of our healthcare system. That is the one standard that we need to go on. The rest we have to measure by that standard. Now, yes, healthcare, we know that people, when there is social distancing, when the framework of your friends, of your family isn't as strong as it is in normal life, and the framework of the social framework here in Malta is very strong, then we are going to have consequences of that. So yes, we keep saying solidarity is an important part of our national response, not just discipline, not just responsibility, but also solidarity. And it's important to be in contact with your relatives, with your loved ones, with your neighbors, to look after each other. That is extremely important. And this message we keep giving time and again and again. And our healthcare professionals, our psychiatric professionals, have come up to the plate. You mentioned Richmond. With Richmond, we've set up the 1770 helpline, open 24 hours a day, 7 days a week. We urge people to phone 1770, 1770. It's a helpline. It's manned by 30 professionals, and they can give you advice. They can sometimes just hearing your problems is already an important step. And if need be, they can put you in contact with psychiatrists and psychologists who can then give you individual advice according to your needs. So yes, there is that problem, but it's part of the epidemic.
You mentioned earlier, you said, we did something right.
I'm not hearing you.
Can you hear me now? Can you hear me now?
I'm not hearing Chris. I'm not hearing you.
Oh, no.
Yeah. Okay.
You're good. So you mentioned before, some of the best decisions you've taken. Are there any decisions that you would take differently today? And I specifically want to ask you about a few. You mentioned lockdown, for example. You said, that's not something, that needed to be measured. But there were also reports early on that you were in favor of a travel ban before the government actually took a decision on the travel ban. Do you think that would have helped contain the situation better? Do you think that there are other decisions, such as the hunting decision, the construction decision, are all decisions being taken correctly, or are there some that you would revisit with hindsight? Are you still there? Okay, we seem to be having some technical difficulties. Let's see. Okay, so we'll just wait till the minister joins us again. He seems to be having some problems with his connection, but he will join again and we'll continue the conversation. In the meantime, thank you very much for all the questions you're leaving us. I don't know if we're going to be able to get through them all, but yeah, there's a lot of questions there that we will try to answer as soon as possible. As Chris Fearne said, and as I said, we're waiting for him to rejoin the broadcast. As he said, a number of decisions are being taken that Malta is actually now ahead of where it was planning to be in terms of the curve. So a lot of the measures Malta is taking have been extremely positive so far. And he also said that there were also some. He seems to be joining the broadcast now again. Yes, just give me 1 second. Okay, so
okay. Looks like we're back. Okay.
So as we were saying, are there any decisions you would have taken differently? Would you have blocked travel beforehand? Would you have disallowed hunting? What?
Okay, so okay, you learn every day. I mean, the whole world is learning every day, and it would be silly for us not to learn from what's happening. I mean, this is hopefully a once in a lifetime experience, but as the population, the global population grows bigger, epidemics will happen on a more regular basis. So yes, we need to learn from this and we need to go forward. Now, I've said this before and I'll say it again. When we come out of this, we're not going to go back to what we were 2 months ago. I mean, things are going to change. Things are changing already, and things will continue to change. And one of the things that we are learning is that we need to have, not just in Malta, this is worldwide, that we need to have a reserve capacity for looking after patients if there are major health disasters like what we're going through now. So I think this is one of the things that the world has learned, that because you see, when things are going right, usually people tend to think that healthcare is something that we can take for granted. But it's not, because when you're with your back against the wall, then that's where it counts. So I think we've realized now that across the world, and certainly in Europe, that we need to have the reserve capacity, even if not on a national level, certainly on a European or a regional level, to ramp up and the very short notice healthcare systems and healthcare capacity, including human resources, if we need in the future. So that's one of the things that we learned and we're learning, and we need to whether we should have stopped travel at an earlier stage. Now, on paper, this sounds almost like a no-brainer. I mean, we're a small island. We have ports which are identifiable, so our border control this could be almost 100% if we close our airports, if we close the ports, if we stop basically ships coming into the island and planes coming onto the island, then we're safe. Having said that, all of the patients who have come in COVID positive from abroad are and have been residents in Malta. In other words, even when we closed travel to several European countries and then eventually to everywhere, we still had to repatriate Maltese nationals and residents in Malta back into Malta, and those were deposited. We've kept them isolated, we've kept them quarantined, and we've done that. Looking back, what might have helped in a very short term, but not significantly, but what might have helped would have been if our quarantine measures early on were more rigorous, in the sense that rather than asking people to do it, we might have put in fines at an earlier stage to make it more rigorous. But as for travel, I don't think it would have made a difference, because, as I say, the positive patients that have come in none of them have been tourists. They're all residents on the islands.
Minister, a lot of people keep calling for a full lockdown. As you said, the measures have been introduced in a staggered fashion. Today, knowing what we know of the situation today, do you think it's likely that we will have at some point a full lockdown, or will we totally avoid this? So it seems we're having another problem with the connection. If so, I believe we will just give it another couple of minutes so that the minister can rejoin. So as we're saying, we've got to fill up the space while the minister joins again. Yeah, what's interesting is what he was saying there, that in terms of the measures that could have been taken better, it's not so much a question of the travel ban, but it's more a question of how soon the kind of enforcement of quarantine measures, including fines and other issues like that, were taken. As we know as well, the government has recently also introduced or is planning to introduce actually steeper penalties for people who even give the illness willfully or on a or even like through negligence and things like that. So I think in terms of the legal repercussions of spreading the virus, that's something that is being done in a bigger way. So again, we're just waiting for the minister to rejoin the stream. We're having some connection issues, but hopefully we will be back shortly. Let's just, okay, I'm just going to take a quick pause. I believe we're managing to reconnect soon.
Okay, I'm back. Sorry about that.
It's okay. It's things that happen in this new reality. So you're telling us about lockdown. Is that something that is likely to be?
Okay, so Chris, what we've done from the very beginning is that we've always followed the scientific evidence of what we need to do, rather than just the political rhetoric or being populist with our measures. Followed the scientific. We want to be on. In other words, we want to be on the curve where at the worst we have enough capacity to provide healthcare for everyone. If the evidence that we get, and the evidence changes from day to day. If the evidence that we start receiving shows that our curve is going higher or beyond the level of capacity that we can sustain, then we might have to increase other measures. What can change this? The public's response. In other words, if people do not follow by and large, in a position where we might not have enough capacity to give everyone the care that they need. We don't want to go there. So if we look like going there, then we might have to bring in more rigorous measures. For the moment, we seem to be on the right path.
Minister, I have to ask you as well about the situation happening in the Mediterranean Sea, right? We've got Malta has closed its ports, yes. and unlike Italy, which is rescuing migrants and sort of keeping them in quarantine at sea, this is not being done by Malta. One, is this something that you agree with? And is this something that requires... is this part of the health advice being given by the ministry? Is this your decision, or is it more of a political decision?
Okay, look, the situation in the Mediterranean, like everybody else on the island, worries me. It's as a doctor, primarily, my job has always been saving lives. So certainly, I am never going to be in a situation where I am going to condone the loss of life or bring about or be part of a decision which brings about loss of life anywhere.
That's what.
So yes,
right?
The situation in the Mediterranean worries. Of course, Malta cannot face this problem on its own, and the situation that we have been facing over the last few years, really, but now coming to a head, is that Malta is facing the situation more or less on its own. Italy has decided to close its ports. The European Union is very slow in recognizing that this is a major issue that we need to deal with. And what we have been asking for the last few days, the European Union to do is to join us in addressing the problem at source. So on the Libyan coast and within Libya and within Northern Africa, not just on the Mediterranean or on our coasts, but at source. So going to the root of the problem in North Africa. And we've proposed tangible measures to do this. We await the European Union's response, and we await this to be a positive response, because this is not just a question of Malta, it's a question of the European Union. The whole point of the European Union is solidarity. I mean, if a part of the Union, and Malta is a part of the Union, asks for help, then we would expect this help to materialize, as long as it is reasonable. And it is reasonable. Nobody wants people to to lose their lives in the Mediterranean. We need to tackle this as Europe, as a European Union.
But isn't using lives at sea now they're possibly drowning as a tool of negotiation with the EU a ridiculous situation?
No, absolutely not. I mean, it's a fact that the people are crossing from Africa to Europe and coming to Malta. It's a fact which we cannot ignore. And yes, we need to bring this to the attention of our partners in Europe, and we need to tackle this as a union. We can't tackle this separately from the union. It doesn't make sense that we are part of the European Union when there are matters that ask for our regulation, and that's fine. We accept that there are European laws and standards, and we want to abide by those. We are a modern country with a modern democracy with rule of law and European in outlook, and that's fine. But then we also expect that if we are part of the union, and Malta is in risk of being overrun by hundreds and thousands of immigrants, then the European Union has to come in. It's just a question of mobilizing and bring this to the attention of our partners in Europe.
But so in the meantime, if there's a boat in our search and rescue area that is begging to be rescued, you condone us not rescuing them?
Nobody said that we won't rescue them if they need rescuing. What we said is that we will notify everyone about this, and then the closest vessel, as has always been international law, it would be expected to pick them up.
Okay, I'm going to move on because we're running out of time. I want to get your opinion on what Donald Trump said yesterday when he decided to sort of freeze the funding to the WHO, because he's claiming that the WHO was biased in China's favor, was choosing political correctness over medical and scientific decisions. Do you think he's got a point in any way? And what do you think are the consequences of the defunding of WHO?
Look, I'll leave Donald Trump to Donald Trump and to the American citizens. What I can say is that the WHO response in China has been exceptional. Incidentally, the person leading the WHO response in China is a colleague of mine and colleague of all of us here in Malta, a Maltese doctor, Gordon Gallia, who's done a fantastic job. I mean, I've known him from medical school, and he's been a colleague in St. Luke's at the time. And he's done a fantastic job in China under very difficult circumstances, and they've managed to bring down the epidemic in Wuhan and Hubei in an exceptional manner. Of course, the cultural scenario in China is different from Europe or from America, but WHO, I think, have done very well. And what different world leaders say is not necessarily always based on fact, but it can sometimes be based on geopolitical posturing as well. So I think WHO have done a fantastic job. I've said that. I will continue to say it. And they have certainly my support.
Given the trend so far, does Malta still need another prefabricated sort of hospital facility?
Okay, so any good coach, any good manager doesn't only have plan A, but we need to have plan B, plan C, plan D, plan E, if need be, because if plan A goes haywire, then if you don't have plan B, then you're in trouble. So we have different scenarios that we are looking at. What we've said in the beginning, and I repeat here, is that we want to be in a position to give all the healthcare necessary to whoever needs it. The limiting factor, we want the limiting factor, because there is a limiting factor, to be our human resources, because we can't bring more doctors out of the air and bringing nurses onto the island at this point when everybody around the world is short of medical staff is difficult. So our limiting factor are the doctors, the nurses, the dentists, the pharmacists, the healthcare professionals that we have on the island. We've rerouted as many of those onto the COVID as possible. We've already discussed this. But what we want is that all of these doctors, nurses, and whoever can give a hand have all the necessary equipment in place. So we need more ventilators, we need more beds, we need more monitors, we need more equipment. And we have plan A, plan B, plan C, plan D to bring all these onto the island. Now the prefabricated ITU, the modular ITU, is plan D or plan E. If we stop at plan, if we go to plan B, that's good. If we have to go to plan D, then we need to have plan D, and
Okay.
that's why we're also going for prefab. Hopefully, we won't need any of this, so nobody dies. But if we need it, it needs to be there.
Okay, just some other quick questions. So first of all, what do you say to people who are saying that there have been price hikes, especially like in terms of medication? I think we've got another connection difficulty. We're drawing to the end of the interview, but we do have a couple more questions. So let's just hope. Let's hope the minister can reconnect in a short while. Okay, so if you're watching, this is the Health Minister and Deputy Prime Minister Chris Fearne. We've been chatting to him for almost an hour now. We're just waiting for him to rejoin the stream for the last few questions. He's saying, what he was just talking about was the plans for the prefabricated hospital to be set up near Mater Dei. Which is a plan that's in process, but might. But he's saying, that's plan D, and we might not even get there. And similarly, when asked about whether we're going to have a full lockdown or not, the minister kept on saying that this all depends on how much we actually respond to the social distancing rules that are being asked of us. So I think we're reconnecting now. No, had another difficulty. Sounds connection isn't working as well as usual. Thanks again for leaving your questions and for following COVID calls. We'll just hang on for a bit longer just in case we can manage to finish this interview. In the meantime, thanks for all your questions. It's going to be really difficult to get through all of these, but I'm sure the health ministry will now take on be answering these questions afterwards, especially if there are some specific ones. Again, we just need to wait a few more moments so that Mr. Fearne can reconnect, so that we can continue the interview. And I think. We've got a reconnection. Okay, Mr. Fearne, thanks.
Because I think
we will have to wrap it up because the connection isn't great. But
okay, go on.
Just two more questions. One, I'd like to get your analysis of steward healthcare. I know that the relations were quite strained before this crisis. I'm wondering whether they're still strained and whether that relationship is unsalvageable. And I'd also like to ask you, only a few months ago you were in the running to become prime minister. Now you're working very closely with Robert Abela, who was your rival, I guess, at the time. How are you working together on this? And just before, I was asking you about price hikes. So price hikes, stewards, Robert Abela, and we can conclude.
Okay, so yes, we have noticed that there have been some price hikes, especially it's the open market of supply and demand, and because the demand has gone up, some of the products have gone up. We have been asking our partners in the business society to be responsible, and there has been a response. So by and large, there haven't been the price hikes that we've seen in other countries. Having said that, we are aware that some of the prices have gone up, and we are asking our partners in the business community to keep these reasonable and under control. Steward Healthcare have been very collaborative during this COVID. So Gozo, I've asked for 120 beds and to more or less double the ITU capacity, and they've done, and they are doing that. So at the moment, there's the process of transferring patients from part of the Gojo General Hospital into another facility is about to start. There was a small technical hiccup yesterday, but it should be going over the next couple of days, which will then liberate the rest of the beds that we need, so that we'll have 120 COVID beds in Gozo. As to the whole general situation with Steward, as you are aware, and as your viewers will be aware, over the last 2.5 months, we've been negotiating and speaking to Steward, though that process is still ongoing. And when there are things to report, then I will get back to you and report. The third question was
about Robert. How are you managing?
Okay, so no, I mean, I'm part of the government. I'm Deputy Prime Minister. You are right. A few months ago, I would have preferred to be Prime Minister, but that's the democratic process.
Do you not regret it now?
No.
You've dodged a bullet?
No, go on. I mean, I don't have exactly the easiest job in Malta at the moment. So I think as a country and as a government, I mean, if something has happened during these 6 months of the COVID epidemic, is that we've come together as a nation, we're pulling the same rope. I don't think party politics have been a major feature in these last 6 weeks. And I hope that we've matured enough politically to make this count even in the months and the years to come. So no, we're working well together as not just myself and Robert Vela, but the whole government. And I think not just the whole government, but the whole political body. And
just one last question.
Collaboration from the opposition as well.
One last question before we conclude or before the connection dies. Some people are asking if we get through the peak and things start to look better.
We will get through.
Is there a consideration to reopen the economy, but to keep travel closed so that we don't get a resurgence until there is
all right, so this is an important question, and the answer is that what you call opening the economy or the retraction of some of the measures will be staggered. So we've put in measures in a staggered fashion, and we'll go out of this in a staggered fashion. So one of the advantages that we've had is that we started to plan early for this epidemic, because unlike other countries, we decided, we realized that this was going to be a global problem from an early stage. So we've come into this epidemic in a planned fashion. But now we're also planning how to come out of it. So we've come in a planned way, and we'll go out of it in a planned way. And again, the change in the removal of some of the restrictions that we have on our social and economic life here in Malta will also be staggered. So it won't be just we'll wake up one morning and everything will go back to what it was 6 weeks ago, but things will be staggered. And there will be some measures which will be lifted earlier, some of them much earlier than others. And then, of course, we'll take it once.
And any expected within days or weeks, or are they all expected?
As I say, Chris, I mean, you keep asking me the last question every day. So this will be.
Yeah, I know.
So as I've said, because you already asked me this question, and I answered this about half an hour ago, we follow the evidence, and what the evidence tells us, we need to go by. Our golden rule is that we have to always keep the curve and the predictive curve below the line that we can provide healthcare for everyone.
Okay, thank you very, very much. It took a bit longer and we had some issues with the connection, but I'm really glad to have had this opportunity. One, to thank you for your work as well, and also to ask you a few questions that I'm sure the public is asking. Thank you very much, and
all the best.
Good luck with the rest of your day. So thank you for watching. As you know, this was COVID Calls, hosted by myself, Chris Peragin. We had the Health Minister and Deputy Prime Minister Chris Fearne with us today in a wide-ranging hour-long interview. And thanks again for all your questions. Again, I'm pity we didn't manage to get through them all, but we obviously had a lot of questions of our own and that were sent to us earlier as well. But I'm sure the Health Ministry will now be looking at some of the specific questions and answering them directly as well. We'll be with you again tomorrow. And thanks, as always, for watching.